Hello, my name is Felicia Spratt. I am the 911 Clinical Director at Behavioral Health Response. Today, we're going to be looking at the St. Louis non-police response model and enhancement to first responders. By the end of this section, I hope that you would understand and know the importance of community policing, the three components of community policing, and how it can be used with first responders, and last, how we can assess an enhanced approach to what's next for first responders here in St. Louis City. Here we have our 911 diversion program. It is considered the first of its kind in the nation. The Crisis Response Unit in of itself is a multi-agency collaboration between Behavioral Health Response, the Metropolitan Police Department, the St. Louis Mayor's Office, as well as the Department of Health. As you look below here, you will see that Behavioral Health Response, the Metropolitan Police Department, the City of St. Louis Mayor's Office, and our Department of Health all equals our St. Louis Crisis Response Unit. With the express purpose of using a straight triage co-responder model, we utilize this to de-escalate, to stabilize, and to divert individuals from jail and or the hospital to a more appropriate regional system of care and community partners. Laying the foundation here is very important to where we're going in our non-police response model. So what is our mission? The Justice and Crisis Response Unit mission is this. We are here to support persons in crises by providing in-the-moment connection, in-the-moment compassion, and linkage to a more appropriate system of care. Now let's look at this. Remember, we said we was going to discuss exactly what is community policing. The Department of Justice defines community policing as this. It's a philosophy that promotes organizational strategies that support the systematic use of partnerships and problem-solving techniques. And we utilize this so that we can proactively address the immediate conditions that give rise to public safety issues such as crime, social disorder, fear of crime, racial disparity, injustice within a community. So let's talk about the three key components. First, we have community partnerships. Having the community partnership is key in anything that you're doing as in regards to a crisis response unit or a non-police response organization. So here we look at our community partnership as a collaborative partnership between the law enforcement agency and the individuals and organizations that they serve in an effort to develop a solution to problems and increase trust in the police. So here in St. Louis, as well as throughout the country, there has been some civil unrest, and it has to be in a level of distrust that has rise within our nation. So having the community partners to come together in unison as a one team has created a safety net for those within our community to where they know now that they can trust others, especially the police, when they are in need or when they are in crisis. The second key component is this. We have the organizational transformations. So here we have the alignment of organizational management, the structure, the personnel, the information system to support community partners and be proactive in problem solving. Here in the St. Louis City, we stand by this. We are one mission. We have one mission. We are one community and we have one voice. And that voice is that voice of everybody who has come to the table in a partnership, and we are doing one thing and one thing only. We are breaking down the silos that are here within our community and in an effort to actually promote more public health, which will directly influence and promote public safety. So how does this fit into your organization? It is important here that your organization has an alignment, everyone coming together organizational wise and realizing that it's going to take a village, it's going to take a community for us to get things the way that we need to be done. And having this in your organization is going to be very, very beneficial as long as the structure has a very, very, very solid foundation. Then your organization will be able to be effective in community policing as well. Then we look at the other component of community policing as problem solving. So here, the problem solving could be just a little bit easier for some, but it might not be as easy for others. So this is the process of engaging in proactive. That's the second time we hear the word of proactive. We have to be proactive in what we're doing in our communities and not be reactive. So engaging in the proactive and systematic examination of identified problems to develop and evaluate effective responses. So with our community policing here, and we gave the definition, but we have to be able to incorporate the community partners. We have to be able to incorporate the transformations within our organization. We have to be proactive in actually solving the problems that are arising. What are those problems, you might ask? It's the gaps in our system. It's what are we doing that has not worked, and what are we doing that's working? What is it that we can actually replicate throughout not just our organization within our community, but throughout our country? That is a part of the problem solving, and I believe that is why you all are here today in this conference and hearing what ways we can work together and stop being silos throughout the United States. So here, what have we noticed here in St. Louis? As far as the non-police responders, why is it that we're going to have non-police responders? We already have a crisis response unit. They're thriving. They're doing great. But let me tell you this, is that with our crisis response unit here in St. Louis, we have 3 in the daytime, we have 3 in the evening. We have identified and found that, hey, we can do so much more if we have some individuals that can respond without the police to these problematic areas I'm getting ready to share with you now. So with our non-police responders that we're incorporating into our vision, our long-term plan, we want to address these areas. We want to address the capacity of first responders. Who are our first responders? Our first responders are our police officers, our EMS. It is our fire department. Those are our first responders that we always look to. And then we have now the crisis response units. They are also our first responders. And so we want to make sure that we have the capacity to be able to actually go out, send those out to those CIT calls that they are actually trained to go into, and not so much just deal with the lower level, the low offenses, the low level or the non-violent CIT calls. We want to be able to use our jails for what they're used for the individuals that need to be there, not for the low level offenses that we are seeing and we are addressing. And we also want to be able to address the gaps in our service. We also want to be able to potentially keep people from being harmed while they're in a crisis. That every response does not need a police response with them. And that's why we are creating the non-police responder model, and it's an enhancement. It's not to take away our CIT. It is not to take away our crisis response unit. It is to enhance what we're already doing here in the city of St. Louis. How is this going to benefit the community? So we would be able to have an immediate response to crises. So many times we have a crisis response unit out and they cannot be at all places at one time. So to be able to immediately respond to a crisis of something that is low level is going to be very, very important for anybody who is looking for a non-police response model. We will be able to reduce the use of force in racial disparities. We will be able to free up officers' time to respond to and investigate more serious crime. I'm not sure if this is like this in your city, but here in our city, we have a shortage of police officers. We have a shortage of individuals who can respond, and to have that alternative method or that enhanced police response, non-police response model would be beneficial to anyone that is in a crisis. And what I mean by crisis, I do not mean that someone has experienced necessarily a homicide, or someone has actually engaged in suicide ideations and have been in an act of doing self-harm, or someone has had an overdose. I am talking about the calls that we're receiving through our dispatch center, where we're addressing sufficient needs, people who are unhoused, people who just want to talk, individuals who do not have or know the next resource to get maybe their bill paid. Those calls can be rerouted and sent to anybody of a non-police responder model, and we will be able to handle it, freeing up officers, dispatchers, everyone else who can be dealing with things that are more serious and more pertinent to making our communities a much safer place. Also, how does this benefit the community? Our own scene needs, the on scene needs will be addressed without any police involvement. We have worked very hard to bring in the trust back into the community. But how many of y'all know that that's not for everyone? So someone might be triggered by a police presence. And so at that moment, we can actually come in, and that would be a benefit to those in the community, because every call does not require a police presence. However, for the ones that do, we're going to make sure that they're there. Our co-responder model under our crisis response unit goal is this. So as far as our crisis response unit, we have a primary response. We can respond by ourselves. How does that look? You might ask. We have one clinician and we have one police officer in our car. That is under our street triage model. And they can respond with no other assistance as long as the person is not a threat to themselves or anyone else, as long as the individual hasn't had an active overdose or they're not actively trying to harm themselves and take their life. We can go with no assistance. Then we have our street triage, the second responder. Now, in this case, it would be the criteria of, are there weapons involved? If it's a weapon involved, we cannot go as a primary. If it's an individual that is barricaded in, we cannot go as a primary, but we can respond secondarily. In that case, a district officer would actually have to be there, and they would have to secure the scene and make sure that scene is safe, not only for the clinician, but also for the independent officer that's addressing that scene. And then we have also under our street triage model is our post-event response. This is where we come in after everything is done. If it's been a homicide, if it's been a school shooting, if it's been anything that's of any type of tragedy that we can provide some follow-up and some assistance to, then we would come in after everything is clear and that person just needs someone to sit with them and talk with them and to help them sort through some of maybe their thoughts. Maybe how do we clean up this mess? How is that get from point A to point B? Can someone go with me to even identify the body of my loved one? We respond to those as well. And this brings us to a non-police responder. This is the only response ever. That person is going to respond to those low-level crimes. That individual is going to respond to anything that cannot be handled by dispatch, but that does not need a police involvement at all, period. What are the responsibilities? I said it and I mentioned it very briefly a little while ago. So crew, as well as our non-police responders, can respond citywide. We can go anywhere within the city. We're not restricted to any one place to assist, support, and act solely as we can act in a support role, we can act as an assist role, we can act as a primary, and we can also act as one that's only going out, as long as it's not an immediate threat to self and others. It's very important, you all. They cannot be in the possession of a weapon, not actively harming anyone. They're in need of any type of social services resources, and if they're a minor. That's who, what, where, and when we can respond collectively. So now let's look at the police responder NPR team. This consists of a mental health professional, a certified peer specialist who ride together assisting individuals in low-level crimes and are experiencing some type of behavioral health crises. And that's what makes the community what it is. That's where we're all coming together as one team, and we're going to do what we need to do to make sure that the folks in our community are safe and they're safe and they're sound without the presence of a police officer. The crew and the St. Louis crisis system. How do we respond? We can be dispatched directly as far as the crisis response unit. Remember, the crisis response unit is an officer and a clinician. The non-police response unit is a clinician and a certified peer specialist. That was birthed out of our crisis response unit. So our crisis response unit is actually dispatched directly to the 911 calls. They can routinely actually patrol the areas originally, making themselves accessible to be able to self-initiate, which is now going to be the responsibility of the non-police responders. And then of course, they can respond to follow-up requests. So what happens after we engage with these individuals? Cases could be handled by a crisis response clinical care coordinator. They can be handled by a peer for targeted case management. They can be routed through our live portal, which sends cases to our community behavioral health liaisons. And let me pause there for a moment. So our community behavioral health liaisons, they're individuals that are connected with our behavioral health providers within our communities. We have 6 different agencies who we have partnered with that we can send our cases to them, that they can in real time assess it, review it, and actually go out and provide people that have more intense case. They need more intense case management time with them. They can actually go out and provide those services with them, or those individuals are already connected to their service provider, and we're just trying to do a reconnecting, a relinkage with those individuals. Then we have cases that can be directed to our crime victim centers. That's for people who are engaged in those interpersonal violence type of situations. For our gun violent crimes, individuals who have been targeted for guns, those who have been shot, those who have been shot at. We can send those cases externally, and that's what makes us unique and different, because we might be triaging in the moment in the care, but we're working with so many different entities where we can collaboratively work together and make sure that we're getting the people the help that they need in the time that they need it. And we already touched on our partnerships and our collaborations. But what's going to be key here is that we make sure that we meet together. For here in our system, we meet with our St. Louis Metropolitan Police Department on a weekly basis. I have to tell you that is very, very, very important. I cannot stress the importance of actually meeting together, coming together, talking, seeing what can we do now? What can we do different? What can we do better? What is it that we can, what are some of the gaps that we need to make sure we're focusing on? This is how our non-police response model came out, because we realized that a lot of things that we're responding to with the police and the clinician, which is great, can really be handled by the civilians. It can really be handled by individuals part of our community. They can respond and make community policing a little bit more effective. Here, I'm just going to go really briefly over some of the presenting problems, but I'm only going to focus on the nonviolent CIT. So the nonviolent CIT, as you see, in 2022, we had 1997. We had 1,997 nonviolent. All of those calls can be handled by someone who does not have any relationship with the police. But more of the traumatic events, more of the violence, more of the interpersonal, more of the suicidal ones, more of the domestic violence, those are the ones that we are expecting to be handled by those who are engaged with the police, because it would put an individual probably at more risk of being attacked, or someone might be a little bit more aggressive, or things can really go left a little quicker than those who are with the nonviolent CIT calls. Our outcomes, as you see, in 2022, we had 2,744 individuals who actually accepted our resources. They were linked to services, or they accepted the resources and they didn't need any linkage. Those are individuals that can be handled, and those outcomes can be rectified utilizing our non-police responders instead of taking our community, taking our co-responder units out from doing those more hands-on, the ones that really need those more aggressive, but a longer response time with them. I also want to point out our hospitalization. As you see, that in 2022, we had 1,048 individuals who actually responded and went to the hospital. Some was sent to the hospital involuntarily, some went voluntary. But if you look in our year, and we're only 6 months in, there are only 349 individuals. Only 349 has had any type of hospitalization in a response from the crisis response unit. So really briefly, you will see that between when we first launched in January of 2021 until now in June, that we have actually we maintained between 99 to 98% of individuals who were diverted from jail. And we actually increased from 2021 to 2023, where initially we had 77% where we were able to divert from the hospital, to now we have 89.6% that has been diverted from the hospital. I would say that that is pretty good in what we're doing here in St. Louis, and we want to continue to keep that up and making sure we are actually getting our folks to more appropriate services so that they can remain in our community and be healthy and whole and safe at the same time. So what's next? I'm glad you asked. What's next for our community is the first responders in St. Louis. It's our crisis call dispatch specialist. Here we will have our crisis call dispatch specialists. They will be embedded in our police department communication center. What does that mean? That means next to the dispatch specialists that are there, we will have someone that's certified that can actually divert crisis calls in the immediate before it even hit the dispatch or go into the community. They will be able to attempt to divert by phone. However, in the case they are not able to divert individuals by phone, they will be able to send out our non-police responders. So our non-police response model, as I told you earlier, consists of a clinician, a master level clinician, a certified peer specialist. They'll be able to assist and help to de-escalate to actually if a person is experiencing a mental health concern or substance use and they're ready to go through their recovery. This is why we have our individual that is a certified peer specialist, because they will be able to assist those people through their lived experience after the crisis clinician has actually completed their assessment and being able to mitigate whatever their need is in that moment in time. And so with those two coming together, and what we're looking at in our St. Louis City is our crisis calls being first routed to our crisis diversion specialists, and they are diverting those individuals. And in the case that they can't, then we're going to stay on a call with them. We're going to dispatch a non-police responder to go, and once they get to that call, then and only then will our CDSs end the call and close that case out, and we will move to the next call. So how can you utilize this in your area? We want to ensure and make sure that there is absolutely positively no crisis behind. So how do we move the system forward? We make sure that we have someone to talk to, whether you're utilizing the 988 method or you have a crisis call center that's in your location. Everyone needs to have someone to talk to, or it could be someone to respond. So maybe we don't need to talk to you. Maybe we do need to be able to respond to you. Maybe you don't have a phone. Maybe you're out in the community, you're in the house and someone see you or someone sees someone in the community. We have to have systems and teams out there that can respond either with the police or without the police. And then we also have to have somewhere to go. And this is where your community partners come into play with. This is why it's so important to have those stakeholders, to be in a collaborative team and making sure that we have our behavioral health crisis centers. The hospital is not meant for everyone. It's not. Jail cannot hold everyone down, because what's happening in our jails is that individuals are going to jail and then they're being released within an hour back to the same thing, not getting no services, not getting no assistance, not getting any type of stabilization that they need. So when I say no crisis left behind, that's exactly what we mean. No crisis left behind. We have to do better as a community, and we have to move the system forward and not become another program that is come and gone on tomorrow. So with that being said, I leave with you my contact information. This is a community, and the community here in St. Louis City stand with all the communities throughout our states and our country, making sure that we're no longer siloed. But if we can work together, we can make the dream work. Because as they say, every team deserves to have a dream, and every dream deserves to be worked. Thank you.